Hello, I'm Tom Harmer, your town manager. Thank you for joining me today for this edition of Talk of the Town. I think we're almost approaching a year into the pandemic COVID-19 emergency phase that we've been in. It started for us back in the middle of March of this past year. And so it's been progressing through different phases, and we've had some recent changes with the vaccine becoming available over the past couple of months. And so today I've invited Chuck Henry. He's the Florida Department of Health representative for Sarasota County, a state employee representing the Florida Department of Health. And so thank you, Chuck, for joining me today.
Well, thank you, Tom, for inviting me. It's a pleasure to be here.
Very good. And so I know you're a very busy person, and it's been probably a flash of a year for you with everything that's been going on.
It has been, and you're correct. In fact, Sunday, the 28th, will be a year ago that I got a phone call from our state office informing me that we had a case in the Sarasota County Hospital, which we believe was the first identified in the state. Turned out to be a Manatee resident, but was in our hospital, and so we worked jointly with Dr. Bensi and Manatee on that case right at a year ago.
Well, and I know in Florida, those of us that work in the public sector, we're very familiar with natural disasters, tornadoes and hurricanes and other events. And typically, they have a much shorter duration. We may have 2 or 3 days of preparation. We may have an impact. We then go into a recovery mode. This type of emergency is so different, for all of us, I think, where you have such an extended period of time like this while you're still kind of in the active emergency stage.
That's very true. And our Emergency Operations Center for the county has been, they stood up probably a week after the first case, and they've been there since. Probably the longest activation they've ever had. And it's probably important to continue to point out that this is really an unprecedented activity across the world, across our nation, our state, and at the local level to deal with a pandemic and a disease outbreak that spans more than a year's time and has a tremendous toll on the availability of supplies and resources as we try to get things out to all citizens that need them.
Well, and I appreciate your availability over the past year. I know we've talked on the weekends, we've talked late in the evening, we've talked during the day, during the week. Whenever I called you, you've been available. You haven't always told me what I wanted to hear because sometimes there's some conflicting interest on maybe what we want to have happen in the town versus what globally you're having to do and work with the other partners and with the state and the direction that you receive. But I do want to thank you for your availability.
Well, I do my best to keep the information flowing because that's important.
Yeah, and you've spoke to our commission a couple times as well, and I know they appreciate that. I wanted to mention to our viewers, we're in 2 counties, and we all know that. And one of the challenges we have then is working with the 2 different counties every day, but especially during an emergency. And so we worked out an arrangement a year or so ago with both counties where we have now a 3-party agreement that says when we're under a state of emergency, we coordinate through Sarasota County. And so I think it's important for the public to know you're not Sarasota County. Sarasota County is Sarasota County government and Sarasota County Emergency Management. You represent the state of Florida and the Department of Health, but you partner with Sarasota County government on a lot of the activities and efforts and reporting and messaging that is involved in this emergency.
Absolutely, and I really couldn't be as successful as we are without the support of the county Emergency Operations Center, communications staff, and many other resources, as you might know.
Yes, and we still have conversations regularly with Manatee County Emergency Management and your peer in Manatee County, Dr. Bensi, but we do look for most of the direction and advice coming from Sarasota County in this event and other emergencies when they're declared. So we've spent a lot of time together working on this. Can you share with the viewers kind of where are we at right now with testing? Let's focus first on testing, but testing results, testing data, the numbers, what does it look like? Are there trends out there that we should be aware of, good or bad?
So I think the trends are good, and I'll talk a little bit about that. Testing continues at a pretty good clip. We average about 2,000 results a day that we're receiving, some days more, some days less. And so people are still getting tested, and that's good. We have seen the amount of virus circulating in our community drop. Our percent positivity, which is a number that we track, and I look at that over a 14-day period, so it sort of evens out the day-to-day changes. That right now is running at 3.43. So that sub 4% number is just probably the last couple of weeks. And it's the first time we've been there since probably mid-August. And so, when school opened, we saw a little uptick. And then, of course, moving through the holidays at Thanksgiving through Christmas, we saw quite a large increase in cases. And now it seems to be coming down. In terms of a case rate, which is the number of cases per 100,000, another number we look at, it's down now to 18.8, which is, again, probably the lowest we've seen it since the summer. The number of cases we're seeing per day of positive COVID is down to about 66 countywide. I will tell you, in early January, we were at a high of about 250 cases a day coming out of the holiday season. So we're very pleased to see that number coming down. And then finally, our hospital numbers are down. When I look at our 4 acute care hospitals in Sarasota County, we today have about 72 individuals hospitalized with COVID-19, 18 of those in the ICU. And that compares with our peak at about 164 in the hospital, and that was in late July.
Okay, very good. I was going to ask about the hospital. Thank you. So what about variants? Are you of the different types as COVID evolves and we're seeing the South African variant and these other variants? Are you seeing that here in our region?
So we are seeing it in the region and, of course, in the state. And if you're not aware, Florida has identified more variant cases than any other state in the nation. Some of that's because we're looking for it and have set up surveillance systems, but not all of that. As you know, a lot of people travel in and out of Florida. There's essentially 3 variants, and you mentioned 2 of them. There's the UK variant, which is B1.1.1.117. Yeah, B117. There's the South African variant, which is a B1.351, and it's very similar to the UK with some slight differences. And then there's a Brazilian variant called P1. There's been about 500 cases of variants identified in Florida to date. Those have resulted in 14 hospitalizations and 1 death. All but one of those has been the UK variant, the B117. And then the one outlier is a Brazilian variant, the P1, which was identified in a traveler. So when I talk about variants, I just want to say, why is that important? I call it the so what. And the so what is because this is new, we expect viruses to mutate and change. So seeing variants isn't a surprise, but the question for scientists is to answer that so what. Does the variant mean it's going to spread faster or slower? Does it mean it might cause more severe illness or milder illness? Does it mean it might be resistant to some of the current treatments we have? Might it create as it mutates, might it increase its ability to avoid detection through our testing systems? Or even more concerning, evade natural or vaccine acquired immunity? And so those are the things the scientists are trying to gather data on. And most of the data is pretty early, so they describe it as research suggests. And so I will tell you the B117, which is what we're seeing the most of, research suggests that it spreads a little bit more rapidly and that it may cause more severe illness. And I say may cause because, as you might imagine, in this early stage of research, most of the cases identified are those that are relatively ill and perhaps hospitalized. And so we may not be seeing the whole picture. What we see is those that are most ill. The South African strain is a little bit of a concern because That one seems to have some ability to evade some of the vaccine and natural immunity. And again, we're very early in the science on that. So scientists are looking at that and even talking about how to adjust some of the vaccines to make sure that's covered in the future. And then the Brazilian variant, early research suggests that it may not be recognized by antibodies that are created from past illness. And so that one becomes a concern about maybe generating a new surge, even in those that have already been previously infected. So again, research is early, and all they can say is research suggests at this time. So I encourage everyone to stay tuned with the news and what's happening from that. CDC puts out a lot of good information, the Centers for Disease Control and Prevention. And the real message for the community is that the best way to stop variants is to stop the spread of the virus completely. And we do that through the things that we've all been doing for quite some time. And that's staying socially distanced as much as possible, wearing of masks or face coverings when we can't social distance, staying home when we're sick, hand washing often, vigorously and often. So those things have protected our community for this past year, and we continue to encourage people to practice those things even after the vaccination.
Now that's a good point, because we received a call here at Town Hall this week from an individual who now has had both their shots. And the comment was, well, now that most of the people on the island have been vaccinated, can't we back off some of the restrictions and stop, trying to enforce our mask mandate and limitations on size of people at gatherings and things like that. And so we've taken the position, and it sounds like this is consistent with your recommendation, is that we're still in a very active stage of infection, and there's still a lot to be learned even from the vaccine long term, and that the best thing we can all do is keep doing what we've been doing.
That's our public health recommendation at this point, and that's CDC's public health recommendation at this stage. And we'll be looking at that percent positivity and the rates per 100,000. Right now, we believe the amount of circulating virus is in what we would describe as a low to moderate level, and we would want to see it low to non-existent before we would want to start relaxing some of our public health postures that have been put in place. And some of that's because, again, we are still learning about this virus and the potential for the variants to cause resurgence of disease. And so we want to ensure we keep our community as safe as possible. And we don't have the data that would tell us that we can relax at this time.
Thank you. Before we leave the kind of the testing data discussion from a few minutes ago, I do want to talk briefly about Longboat Key, again, being in two different counties. Thank you for your help, but we've struggled for a long time trying to figure out what were the numbers on Longboat Key. And both counties and the state handle it a little bit differently, I think. So Manatee County government, Sarasota County government has their own heat map that is zip code based, and I know they all feed off probably similar data, but I think we discovered with your help that a lot of the cases on Longboat Key, because we're in two different counties, are in the state database, but they were defaulting to the Manatee County portion of that. So even today, when you go on the state website, by far, over 200 are positive show in the Manatee County side, and only 7 show in the Sarasota County side since the beginning, the cumulative numbers. And so over the past month or so, you've been giving us separate numbers for Longboat Key, and we've been distributing those to our commission and to the public. And so I want to thank you, because as an island, we're a little bit unique in that we're one zip code, and we're surrounded by water, so it's no one else but us. And it's nice to be able to at least know at that level what's going on here locally. And you can't tell us what house or what condo, but at least we kind of know on the island what that number looks like. So thank you for helping us trying to sort through that with a state database that kind of can make it a little difficult for us.
Well, happy to do that. And it does, as you know, require pulling some data. And for your viewers, we pull that data based on what we call the event date. So that's the date the illness is reported or the illness occurred. And sometimes that can be a week before we get the test results, because as we investigate, we go back to figure out when did they get sick. But that's the most important date from a public health perspective, because that tells us the amount of virus circulating, causing illness on specific dates. So when we pull that weekly data, we're looking at how many those case numbers are, how many events occurred, new events during that time period.
Yeah. So thank you for that too. So let's talk a little bit about vaccines. I'm not sure where even to start with vaccines, but I remember when your office received their first allocation of vaccines, and I know we felt it here locally in the town, and that there was so much demand and there just wasn't enough supply. And it's still that way, but the supply has been increasing, and also the way it's being distributed. There's a combination of, there's a federal program, there's a state program, there's the local county through FDOH program, there's the pharmacy program. Can you kind of give us a sense of kind of the vaccine program, maybe quickly how it evolved and where it's at today?
Sure, I'll do my best. So, obviously initially when the federal government started pushing vaccine out, each state got an allocation on a weekly basis, and then the state of Florida would take that allocation and split it up amongst the counties. I think initially they did that based on overall population of a county. In the last few weeks, they've begun to shift that and look at what's the population of the target group. And that really has helped us. As many of you know, Sarasota County has 37% of our population over the age of 65, which is about 160,000 full-time residents, plus any of our part-year residents that fit that group. So early on, we weren't getting as much vaccine as we really needed to move through that target group as rapidly. So that's increased for our allocations at the county level. And the vaccines that we're distributing from the county level now, we're pretty much committed to using the county registry system that was established about mid-January. And as when we established that, we kind of committed that we were going to take people out of that registry based on the time that they registered and try to do a first in, first out kind of basis as the fairest way to distribute. I know different counties are doing it different ways. I think Manatee has a registry, but theirs is more of a random lottery from the registry. Ours is going by date and time stamp of registry. And we're working through that. I think we're serving up to about account 50,000 now, which is more than the number sounds, because each account could have two individuals. And in fact, probably almost 40% of our accounts have two individuals registered in them. So that's with our county systems, and we're really trying to stick with that so that we can stay out of some of the political fray around this neighborhood or that neighborhood, and just pull from the directory, even when the state brings us opportunities. And we have these, this is a second way that vaccine comes to our county. The state comes in with their incident management team, and when they have vaccine and makes it available to our county, sometimes they already have a targeted area in mind. Sometimes they give us a couple of options for where the event could occur, depending on the size. And so we have been successful so far when those events come in and saying, well, we really want the vaccine because we need it for our community, but we need to pull the appointments off of our central registry so that we keep it fair for all citizens. The only exception that we've made to pulling everything directly off the registry are events that are targeted for our minority populations, especially the lower social economic groups of color that we want to ensure have access to the vaccine, that have a little bit more difficulty getting into the systems. And when I look at the data, the percentage of those populations vaccinated, when I look at our over 65 groups, was significantly behind all the other groups. So with the exception of that, we try to pull everything directly out of our registry system. Now, in addition to those, there was initially the Publix program that was supported with state vaccines that didn't come to Sarasota at all. And then when the national pharmacy vaccine program started, then the Publix in Sarasota County were included in that. And so our Publix are in the national pharmacy program. Some of the Publix in other areas of the state are still getting vaccine through the state program. But to the consumer, that's pretty transparent. They don't really see where it comes from. But Publix has their own registry system that they open up, I think, twice a week now, and book limited appointments at each store. Winn-Dixie stores, I think there's one online in Sarasota County, also have their own appointment system and are booking limited appointments at their facilities. And we're told that Walmart and Sam's Club in Sarasota County will come online probably early next month. And so that's what I'm aware of now. And those all are separate registration systems and separate avenues that citizens could get vaccines outside of our county system.
Yeah, and I know just listening to you and knowing a bit about what's been going on, it's complicated for the residents. It is. The bulk of the program, I think, is managed through the Florida Department of Health and the local ones. But now that we see the state teams coming in pop-up sites, and we now see the federal teams coming in a couple locations in the state, and we have the Publix and the CVS, and it's not the same registration system. And so, I know we've talked to our residents, and they end up registering in 10 different places. And many of them have traveled for hours to go get a vaccine and now have to travel back again for the second vaccine. And it's not a single source to kind of get in line. And like you said, even in our two counties, one of them is lottery based and one of them is in order of sign up. I do appreciate that when the pop-up sites have occurred here, that you and Sarasota County have requested, and so far that's generally been accepted, that they use that existing system, because from a Longboat Key standpoint, that means our residents that are signed up will then get access to that. Even if they have to drive 45 minutes, an hour and 15 minutes, at least they're in line and they can get access to that, and it's not just for a specific area. So that's been a benefit, but it is complicated because of the so many different places you have to sign up to get into that particular location or pharmacy, etc.
I would agree with that, and I appreciate your comment on the pop-ups and using the registry. I think that continues to be important, at least until we can work through all of our 65 and above group. And as you're clearly aware, because we've had the conversations, but your viewers may not be aware, you continue to call at least once a week, if not twice a week, and ask about us holding an event on the island. And the long and short of it is, we could look to do that, but we would have to pull from the registry. And so I just look at the logistics of sending people from all over the county onto the island. And I realize that people from the island are going to the other sites as well. But that's really been the factor that has said it doesn't seem like we're ready to do that yet. I hope in the future that as we move through our 65 and above group and move on to more of the general population, that we'll be able to do some more focused geographic sites that aren't necessarily tied to a registry, so they'll be more convenient for residents to access vaccines near their home.
No, and thank you for bringing that up, because I think we've tried to pitch everything we could to convince both Sarasota County and Manatee County, as well as the state of Florida, to do a site here on the island. And I know there's been various reasons why so far the answer has been we can't do that yet. But it is, our residents are frustrated. We've again thrown, I think, the kitchen sink at it. We've presented churches, we've presented private medical groups, we've presented the town itself, we've said we can help support a site. And I know even though we haven't had a site on the island yet, you do track the number of people who've been vaccinated. And it is good to see that number is higher than we thought, and it continues to increase. So I will say that our residents are being resourceful, and they're signed up and they're getting inoculated. But I don't know if you have any data you can share with what the current status is.
Sure, and I'll give some general vaccine data for the county, and then I'll talk about Longboat Key. As of today, we have 82,923 residents that have been vaccinated countywide, and so those are individual people. So that's a pretty good number as we move forward. For those 65 and above, that number is 67,885, or about 42% of our overall county residents over age 65. Now, I have to qualify that by saying that's the census number, 42% of the census number, and so we know that we have a lot of part-year residents that aren't in our census, so that percentage is probably not as high when we take that into account. When I look at Longboat Key as of this morning, the data was showing 3,526 individuals have been vaccinated from that zip code. And Tom asked me a question, do I know how many of those are part-year versus full-year residents, when we were chatting just before we started today, and I don't know that. When people fill out the consent forms to get vaccinated, they provide a contact address with zip code, and if they use an address on Longboat Key with that zip code, then it would get associated with Longboat Key. So I'm not able to separate that out.
So knowing where we're at today is you can get a vaccine, or you can sign up for a vaccine at various places, the county system, the Publix, depending on the CVS, not ours locally here yet, but through CVS and other counties, et cetera. Where do you see that evolving now over the next few months, both on availability and quantity of vaccine, but also eligibility requirements? Where do you see that, and how do you see that evolving over what kind of time frame?
So let me start by talking about two groups that we're really working hard to put something in place for that's really important. One of those is our shut-ins, those that receive home health services and are unable to get out, and we're working through a couple different options. One of those being the state incident management teams may come in and provide that service for us around the county. We're working through some questions on how do we make sure we're covering everybody, and how do we get people registered into that system. The other is where do people go that are not 65 yet but have significant underlying health conditions that make them more susceptible to negative outcomes. And right now the answer is they work through their physicians with our hospitals. But the reality of that system is that the hospitals, when they do have vaccine, are focused on their patients that meet that criteria, and they have hundreds still lined up. So we have people in the community that aren't getting access. So we're working on those two. So I just wanted your audience to know that we're working on that. In terms of where things are going in the future, I think as more and more vaccine becomes available, you'll see some new categories pop up. The governor talked at a press conference earlier this week about inclusion of law enforcement and teachers, and that may have maybe an age requirement of over 50. I'm not sure yet. They're discussing that at the state level. We anticipate seeing some guidelines through the form of an executive order in the next couple of days on that specifically. We talked at the press conference about doing that through those 4 big federally supported vaccine sites, and the closest one to us is Tampa. I suspect it'll probably be a process for us to be able to do it locally as well, since it's hard to send everybody in the state to 4 sites. So we're waiting to see what that looks like. There was also discussion at a press conference of once the 65 and above group hit a consistent more than 50% vaccinated threshold across the state, that they may look at lowering the age to 60 or maybe 55 in increments to begin including more people. So those are things being discussed that haven't happened yet, but we expect them to happen over the next month. And when they do, we'll have to figure out how to integrate that into our current systems. And then most encouraging to me is the potential for a new vaccine, the Johnson & Johnson vaccine, to be approved today. That may have already happened. I just haven't had time to look at the news. But when that happens and they begin shipping that, that's a tremendous help. It's one more vaccine into the system. It's a vaccine that only requires 1 dose. So right now, essentially, we have to to schedule everybody twice, so it'll cut the workload in half for vaccinating. So we're very excited about that. And at the same time, the amount of vaccine from both Pfizer and Moderna is increasing every month. And so as that increases, they will begin to open up the pipeline for our local healthcare providers, local pharmacies, other outlets that you would normally go to, like for flu shots, to order it direct from the federal government and be able to distribute it. And so that's really the point we need to get to, so that it's available in multiple places around the community.
So is there one place for information for the public? Is there a particular, is there like a Florida Department of Health website that will list all the different options on how they can sign up? Or, where do we direct our residents to get information kind of in a broad way of every opportunity that's out there for them?
The county website at scgov.net does a really good job of providing information about our vaccine sites in the county registry. Their site, nor does the health department's, list all of the other potential avenues, but that's a great idea I can look into, rather than, at least we could create a list of separate websites that they can check. Publix, you go to publix.com. I think Winn-Dixie's has a little bit longer. When Sam's comes online, there'll be one there, but we can begin to list those websites so that at least people can link into those and find out what they need to do to try to register.
I think that would be helpful, just because there's so many options out there, and the people that I talk to are signing up on multiple options. So if they know, that they can place their name in the hat at Publix, at CVS, at Winn-Dixie, many of them are trying to do that in addition to the county or the county's site. So, I think that would be helpful to help, provide as much information as possible.
I agree completely. So we'll look into doing that. And while we're talking about people signing up everywhere, the other big message that we're trying to share is that if you signed up in the county system, but you were fortunate enough to get into Publix or Winn-Dixie or another county and get your vaccine there already, we're asking people to go in and delete their county account. And what we're finding is, for example, the last event we had that had 3,000 doses available, we had to send out 5,000 appointments in order to fill 3,000 slots, because people get the appointment and say decline or not available. And we're discovering a lot of those are saying that because they already got their vaccine. So we're just trying to clean that up and make our systems more efficient, and we just ask citizens for help with that.
No, I think that's a good message that, if you have received your shot somewhere else, hopefully it's easy to go in and opt out or cancel that registration, but that would be good, I know, for you guys.
It is fairly simple, and there's a how-to video on the county's webpage for anybody that wants a little video instruction on how to go in and delete their account.
All right, good. I know you mentioned earlier how important it is for the foreseeable future to really follow those guidelines that are still out there about social distancing and wearing a mask and washing your hands and those things. So that, or anything else that you want to share with our residents as we kind of wrap up our discussion today, I'd appreciate it.
Sure. I might just mention some of the why behind that. Science is still studying these brand new vaccines. And while they're very effective at preventing death and preventing severe illness, they're not 100% certain that you still can't acquire the virus and transmit it to someone else. And so until they have clear science on that, they're asking everyone to continue that social distancing and wearing of masks so that we can help prevent the spread of disease to others that may not be vaccinated yet.
Well, what I find interesting is the articles about the flu, and this season the level of flu, people becoming ill with the flu, is so far down compared to a normal year. And I know there's probably speculation out there. A lot of what I've read kind of ties it back to all the precautions that people are taking for COVID, is having that side benefit as well.
I would agree with that completely. And I look at data reports every week on flu in Florida and flu in Sarasota County. And I will tell you, when I look at our line this year, it's almost flat, almost non-existent compared with regular robust curves for the past 3 years. So significant difference. A lot of that probably due to the measures we've taken to protect our communities and ourselves from COVID. Some of it may be also due to strong suspicion of diagnosis for COVID and maybe not as much time to search out and diagnose flu. But either way, the two of those combined have really flattened the flu curve this year.
Good. Well, anything else for our viewers before we wrap it up today?
No, I just appreciate all that everyone does to keep themselves and our community safe. Their continued patience as we move through getting vaccines out as rapidly as we can, and certainly the opportunity to come and share questions with you in this forum. I think these are important, so thank you.
Thank you. And I want to thank our residents for continuing to take the necessary precautions. We've been very fortunate on the island. Our numbers, relatively speaking, have been low, but we've still been concerned. We've had spikes like everyone else, and even though we all have a little bit of fatigue due to the COVID and the duration of this emergency, now's the time to not let our guard down. So thank you for joining us today for this edition of Talk of the Town.